Welcome back. The next chapter we're covering is facial treatments in the Standard Aesthetics book, which is chapter 8. The learning objectives for this chapter is to explain the importance of facial treatments as the foundation for all skincare services, describe the benefits of a facial treatment, list the essential skills needed to successfully perform facials, perform the facial setup procedures, explain the key steps of the basic facial treatment, describe how to consult clients on home care, discuss variations of the basic facial, outline the treatment goals for 6 skin types and conditions, describe acne facials, perform an acne treatment procedure, discuss men's skincare treatment options, and perform the facial treatment procedures. So the reasons we should have a thorough understanding of facial treatments is because it's going to be the foundational skill for all skincare services. It's going to be what we're doing the most of. It also is going to allow us to provide education and consultations on how the skin works and the overall skin health to the client. Also, facial treatments are going to focus on creating an ongoing program for our clients' skin health. So we should be able to keep updating what we are doing on our clients to make sure that it's in the best interest of the client and using the products that are best suited for them. So a facial is a professional service designed to improve the appearance of the facial skin. So typically it's going to include a deep cleaning, hydrating, massage, masking. You can also do some mild peels or use treatments with machines. And also you may apply serums, and you would be typically applying moisturizer and sunscreens. So each facial should also be customized for each client. So you shouldn't have just a one-stop, like you're only using your kit. Feel free to use your kit, but also feel free to use anything that's in the back bar, because you really want to tailor each facial and each product to the client for what is best suited for their skin type. So overall, there's a lot of benefits that come with facial treatments. It deep cleans, it exfoliates, increases circulation, it relaxes the senses, the nerves, and the muscles. It slows down premature aging. It addresses skin conditions. It helps soften the appearance of wrinkles and aging lines. It helps lessen the appearance of blemishes and minor acne. It provides access to an esthetician's expertise for at-home care skin maintenance. And it also supports the skin health and making good lifestyle choices. So something that you're going to have to remember, that as an esthetician, we cannot diagnose or treat medical conditions like rosacea or cystic acne. We can help in conjunction with proper medical care. So if someone tells us that they have rosacea or cystic acne, we may be able to recommend them products that they can use to help calm it down, but we can't actually treat it or say that we can treat it. Our first question is, as an esthetician, what primary activity can you not perform? The skills that we need to have as estheticians is going to be customer service and proper communication skills. So knowing how to connect and communicate effectively with clients is going to be like one of the most important, if not the most important skill to have, especially when we go to rebook clients. Also having exceptional skills, so having knowledge in skin histology, skin analysis, and skincare products or ingredients is going to be essential in making informed decisions for the client. Also, knowledge of contraindications and technology advances and other facial equipment is going to be important for safety. Also, massage techniques are important to know. If you master retail sales, you will also make a lot of money or have the potential to make a lot of money, especially if the product line that you use, clients can only buy it from you. If they can go purchase it from a store, say Ulta or Sephora, they may just go there to pick stuff up. But if people can buy from you, you will make a lot more money. So increasing your education is super important as well, and you are going to have to do some continuing education to keep up your license once you get your license. So taking classes at a skincare academy or participating in an online webinar on skincare education, especially if there's a brand that you will use. A lot of the times that brand might have webinars that you can watch or listen in on to understand product knowledge for that brand. Staying informed, so subscribing to online news resources, watching interesting or informative television or YouTube or Instagrams from reliable sources, and reading books on a bestseller list. Also, attending at least one aesthetics class or conference every year would be beneficial, and getting degrees at the associate's, bachelor, master, or even doctorate levels would be obviously continuing your education and maybe doing more invasive services. For example, if you went into nursing and maybe wanted to become a nurse esthetician, that would be something that would be kind of cool and very, very bougie for sure. The most important aspect to client retention and having a successful, long-lasting career is going to be these key elements. So focusing on the client, you want to be genuine in your concern, you want to focus on their needs and their skin concerns, and you should be giving your client, whoever is at that appointment time, your full attention. So don't have distractions, don't be on your phone, don't be chatting with the coworker. Give your attention to that client that is paying for that service for that time. Client comfort, so you can help the client relax by speaking in a quiet and professional manner, or not at all. If the client just wants to sit in peace, remember that. You can also provide a professional atmosphere and work efficiently. And you should make sure the client is comfortable, so ask them if they want a bolster, do they want a blanket, etc., etc. Make sure you always wear disposable gloves when you're working on them, and keeping your nails smooth and short so you're not going to scratch them. Also, you should remove all of your jewelry so it's not brushing up against them or scratching them. And also be aware of your touch and the amount of pressure that you apply to the face. So you don't want to be so rough that it hurts, but you don't want to also be so light that it just feels like you're feathering them, if that makes sense. You want to inform the client, so provide a skin analysis and educational consultation. You should also be explaining the benefits of the products and services and answer any questions the clients might have. And although you want to answer every question clients have, if you don't know the answer to something, just let them know that. Just say, hey, I'm not 100% sure, but let me do some research, or let me ask my instructor, and let me get back to you on that, because that would be a good learning experience. You shouldn't know all of the answers. I don't know all of the answers, and being a professional and being a pro at something, you're not going to know all of the answers, and you should be able to admit you don't know all of the answers. You should be able to look up the answers and then find out information that way, so then you do know the answers for when another situation of the same question or something like that comes up again. You should also be diligent, organized, and skillful, so maintaining a neat and clean condition, arranging your supplies in an orderly fashion, keeping implements in a closed container when they're not in use to keep them sanitized or disinfected properly. Also, following some systemic procedures, measure or use pre-measured products for consistency and best results. Also, apply and remove products neatly, and do not let water or products drip down the client's neck or into their eyes or ears. First impressions matter, so when you are first meeting a client, that's going to set the tone for the relationship. So you should always approach with a client with a smile. Always introduce yourself to new clients and greet returning clients by their name, so it looks like you at least remember them. A brief yet warm handshake can also make the client feel welcome. Set aside a few minutes to take new clients on a quick tour of the facility. It's also a common courtesy to devote devote the time that you're with your client to their client and their needs. So you shouldn't be discussing your own problems, and you should also be professional and genuine. After we've greeted our client, we would want to help prepare them for the facial treatment by giving them specific changing instructions. So you would want to show where your client would change and where they can store any of their belongings. You would also want to instruct them how to put the spa wrap on, and if they want to remove their shoes in the changing area or at the treatment table, they can, but if you want to just ask them to kind of place them under the table so then you don't trip on them, that would be a good idea. You should also explain what clothing should be removed for the treatment that you're performing. So if clients want to keep their pants on, that's totally fine. If they want to keep their shirt on, if they decide they don't want to change into the spa wrap, that's totally fine, but you would have to let them know that then you wouldn't be able to treat their neck and décolleté just because you wouldn't want to get product on that. You would also want to remind them to remove any jewelry that they have on, including necklaces, so you can get product on their neck and décolleté, earrings if that would be uncomfortable with the head wrap, and then any bracelets or rings if you're going to be doing an arm and hand massage. You would then want to assist the client onto the facial table, so you should show the client how to get on the table safely and where they should position their head. You can also help them up with the step stool if they need it, if they're a little shorter. You should also help assist the client in getting comfortable, so offer them a bolster or help cover them. And draping and adjusting for comfort, so draping the client's hair so no product gets in it. Also, if they need a pillow or something under their head, you can use the face cradle and put that under their neck. I would put it under the sheet so it's not touching directly on them. And these procedures, you can refer to procedure 8.1 in the book, which is pages 349 to 352. Some things that you should do to keep your clients and then also you on schedule is to have any client come in 15 minutes prior to their appointment so they can fill out the intake form, and you have time to do a consultation and they have time to put on a wrap and prepare for the treatment. You can also send calls or texts to the clients the day before to confirm their appointments, and you can also ask the receptionist to check the client in and have them prepare for the service. You can have the client intake form ready to use in the reception area so then no time is wasted in the treatment room as well. So question 2 is, what 4 practices help keep the client and the esthetician on schedule? Our initial consultation and analysis is going to determine the products and procedures that you do on the client. You should discuss the recommended treatment as well as any of the client's home care needs. Many estheticians schedule at least 15 minutes extra for the client's first visit, and you should review the client's completed initial consultation form. So you should obtain signed consent, so the client should read and sign the consent form, which acknowledges the treatment process and the risk involved. You should then follow the proper client draping and hand washing procedures, so draping properly by adjusting the head drape, pillow, linens, and basically everything that we specifically do, and draping the hair with a towel or a headband, placing the bolster under the knees, and then washing your hands before you touch the client at all. You then would perform an initial skin analysis and agree on a treatment plan. So before even cleansing, if there's multiple procedures that you would be doing or multiple treatments that you offer, you would want to inspect the skin type and conditions of that client, ask the client if they have any skin concerns, and then you would pick and create a treatment plan. So you can formulate a clear and precise plan of action, explain the benefits of the products and services that you would be doing on them, and then answer any of the questions that the client has. And then the next step would be to complete the facial cleansing with an appropriate cleanser. The book also recommends using a toner after the first cleanse, although I know we learned that you should do it at least for sure after enzymes would be our first one, but feel free to tone throughout the steps if you feel necessary. You can also apply a few warm towels for a few minutes to help prepare the client for your touch, warm and moisten the skin, and then make cleansing a little bit more effective and enjoyable. You should always wash your hands before starting any treatment and putting on gloves. You should cleanse to remove impurities and makeup, so you should choose the cleanser based on that client's skin type and their concerns. So typically cream-based is going to be for dry and mature skin. There's mousses that are good for combination skin, and gels and liquids are good for oily skin types. You should remove any eye and lip makeup, so before cleansing, you should remove the client's makeups for a full facial and making sure that the client is not wearing contacts. So that would be procedures 8-2, which is pages 353 to 355. You would then cleanse, and you want to avoid overstimulating the skin. And the book tells you to double cleanse if there's makeup residue. I recommend just double cleansing all of the time because you do want a very deep cleanse for people that are paying for a facial treatment. And then you can tone. So toners are going to remove any residue left from the cleanser if you're using a 2x2, and they help restore the skin's pH balance. Astringent formulas help reduce the appearance of pores, and there's different formulas that can help with different skin problems, and they can be applied with saturated 2x2s, or they can be misted on the face, which if you're wanting to help remove any residue left over, you would need to use the 2x2s because the mist isn't going to remove anything after that. So cleansing product is going to be procedures 8-3, which is pages 356 through 358. You would then do an in-depth skin analysis, so you should complete a thorough skin analysis with the magnifying lamp. You can also use a Woods lamp or another electronic imaging system after cleansing. You should then check for skin conditions or contraindications that would prohibit a facial. And if you are ever unsure, wait and have the patient obtain clearance from their physician for facial treatments. The 4 components of a skin analysis would be to look, so looking with your eyes, touching with your hand to see if you feel any texture, look at the elasticity. You would want to ask them questions if you're unsure about something, you see a spot, ask them, hey, like how long has this been here? Have you always had this? Or when did this show up? And then you would want to listen to what they're telling you. And then you would record your findings, mostly in objective if there's anything that you see visually or you feel with your hand, and anything that they tell you, you would want to write that in subjective. And then in the client's charts, you should write down any information or changes that have occurred in the client's skin. You should also be using them as a reference every time that the client returns, and you should record the procedures and the products that they use. And then eventually, if you do retail, you want to record the products that they've purchased for at-home use. And then the next step would be exfoliating. So exfoliating a product or a mask, because exfoliation is going to help make the skin smoother. It also helps product penetration by unblocking the surface and promotes stimulation, which is going to increase the cell turnover rate. And methods, we have mechanical exfoliation, which can be used with a rotary brush or a microdermabrasion machine, and that's going to gently remove dead skin cells and aids in a deeper cleansing. There's also granular or manual exfoliation, which is using a granular product, so that would be like a scrub or like a pumice stone, so something that you feel the grittiness to is going to be a mechanical exfoliation. And then chemical exfoliation is going to be chosen based on the level of accumulation of dead skin cells and skin sensitivity. So you can use chemical peels that are not as intense, and then a little bit deeper chemical peels, although we would only be using superficial peels. There are some that vary in strength. And chemical exfoliation overall is used to lessen the appearance of wrinkles and also skin discoloration. You can also use some electrotherapy. So dust incrustation with galvanic would be something that we'll learn more about next semester. But dust incrustation is the process used to soften and emulsify sebum, like comedones in the follicles, and they help with blackhead extraction. And if they're very deep, a dust incrustation solution would be used in conjunction with the galvanic machine, and that makes it easy for them to come out. A desincrustation solution is going to soften the sebaceous material around the edges of the pores or the follicle openings, and it helps soften the comedones, making them easier to extract with minimal trauma to the surrounding tissue. So a desincrustation solution that we would use is going to be softening gel. So desincrustation solutions are typically a little bit more alkaline than the pH of the skin. So that would be what you would use to help soften the sebum in the pores to make them easier to extract. You can also use some steam or warm towels during your facials. So both of them are going to promote an effective cleansing, since the warmth is going to help soften the follicles. The steam should not be used for longer than 10 minutes. And steam can exacerbate existing conditions, so it shouldn't be used on people that are very, very sensitive or have rosacea. And warm towels can also be used in place of steam or for product removal during treatments. And you should always check the temperature on the inside of the wrist before applying it and keeping it away from the client's nostrils so they can still breathe. And for the use of a steamer, it's typically used before a deep pore cleansing. I would recommend using it during the enzymes because it helps activate the enzymes for a little bit deeper exfoliation. It uses a warm humid mist to soften the skin and allow easier removal for comedones. The nozzle should be placed approximately 18 inches away from the client, and it can be positioned above the client's face or below the client's face. And again, remember to not use a steam on inflamed, sensitive, or rosacea prone skin. Then you would do extractions if you're going to do extractions or a deep pore cleansing. So the technique of manually removing comedones from follicles is called extraction. Cleaning out the comedones allows for the follicles to contract back to their natural size if the skin elasticity is good. And although we can't use lancets, it might be necessary to gently open papules and pustules with a lancet if it's allowed by a state that you want to move in. You would then do a massage, so that's going to promote a physiological relaxation. It's going to stimulate blood circulation, help muscles tone, cleanse the skin of impurities, softens sebum, and helps slough off dead skin cells, and helps relieve muscle pain, and provides a sense of well-being. The products that are used for massage are going to have certain benefits, and you want to choose the product based on the skin type. So you can use an oil for extremely dry skin, cream for dry to normal skin, and a gel for a combination to oily skin. And they can be performed at different times during the treatment, and you should apply with warm fingertips. You can apply it with a fan brush. Typically I just go in with my hands and my fingers because that's what I'm going to be massaging with anyway. You would then want to apply a mask. So there are different forms of masks that are used for different effects on the skin and skin types. So some can draw up impurities and clear up blemishes and tighten and tone the skin. Some can hydrate, some can calm or rejuvenate the skin. Masks can also be applied at different times, which would depend on the function, and different towels or gauze are going to be used to remove the product. And you can use a cotton compress or a mummy mask. That would be helpful for what I would recommend doing for clay-based products at least. And so a couple of the procedures that you should look at in your book is procedure 8.4, which would be to remove products, and that's on page 359 to 361. There's also procedure 8.6, which is applying and removing the cotton compress, and that is pages 372 to 374. and procedure 8.8, which is applying a sheet mask, and that is procedures on page 379 to 380. And then the finishing steps of the facial, we want to tone. So you can help take off any of the product with a 2x2 in the toner or just mist over, and that's going to help balance the skin's pH. You can also apply serums, any eye treatments, or lip products if applicable. So serums are going to be concentrated ingredients that are used for specific corrective treatments, and some serums and ampoules are applied with the fingertips, and they can be used under the mask or a moisturizer, and they can also be used in treatments with facial machines. And then eyes and lip creams can be applied with a fingertip or a cotton swab. You would then apply a moisturizer for that client's skin type. So depending on the formula, some of them help seal in moisture and help reinforce the barrier layer of the skin. And emulsions can either be cream, oil, or gel based. And moisturizers also can help hydrate and balance the oil-water moisture content of the skin. And then the last step, which we always want to do, is apply sun protection. So that's going to be the final step of any type of facial treatment that you do on someone. You want to apply a full spectrum sunscreen, and it's especially necessary after you do any chemical peels on a client. And then once you're completing the service, you want to remove your gloves and let the client know that you're finished, and then offer them assistance off of the table if they need it. You would then want to do an end of service consultation. So you should explain to the client what they should do next and offer water to rehydrate them after the service. If you're going to do retail, you should recommend products and write them down on their home care instruction sheet. You should explain what the products that you should recommend scheduling the next appointment and any other services that would benefit them. You should ask what products they would like to take home with them if you're going to retail them, and you should thank them for coming. And the post-service procedure is procedures 8-9 in the book, and that's on page 381 to 382. And for a post-service checklist, you should record any of the client chart notes in your soap notes. You should write up any retail sales if you did retail, and prepare the room for the next client or clean up the room in preparation of the end of the day. So home care is probably the most important factor in having a successful skincare routine. So a program is going to consist of a long-range plan that involves the home care and any treatments and education that you would do with that client. And after the first treatment, you should do the following. So you should block out time. So take 15 minutes to explain proper home care to the client. You can have the client sit in the facial chair or invite them to move into a well-lit consultation area and provide a mirror so they can see the conditions that you would be discussing. You should explain in simple terms and inform them how you propose to treat those conditions with any treatments that you would do, and show the client the products that you want them to use, and including in the order which they would use them. Also let the client know that the products are available for purchase and give them written instructions on how to use them. And the best way to recommend products for clients is you want to know the client and their habits. You should start by suggesting 2 basic products based on their main concerns, like a cleanser and a moisturizer, and that's always easy to add a new product to their regimen too. But starting out at least with a cleanser and a moisturizer goes a long way, especially if someone is starting from nothing. You should focus on delivering results, and you should not coerce them into buying more products than they want or when they need, because that overall your client would be more likely to trust your expertise in return for another treatment if you are honest with them. So there are some variations of a basic facial, and the steps are going to vary depending on the focus. So you can omit the steam or massage if it's not necessary, or if they are, if you're going to do like a very quick facial, or if their skin is a little bit more irritated, those would be things that I would recommend to omit, and maybe do a double mask instead. So like maybe more of a treatment mask and then maybe more of a calming mask. You could massage after the mask if you want, and some estheticians use massage after the application of a mask, since the massage creams and oils can help prevent product penetration and the benefits of the active ingredients in the masks. But that's why I also try to use a facial towel to remove the massage medium. But if you want to try it out, try it out. And overall, the procedure is going to depend on that client's treatment goals. So if the goal is to hydrate and calm the skin, you would want to omit the cleansing mask and any of the extractions. There is an express facial, which we will be able to do and we will learn soon, and that is known as a mini facial. And the main differences from the basic facial is the time and then the number of steps and products that are used. So the express facial is going to take, of course, less time. So it takes about either 15 to 30 minutes instead of a full 60-minute facial. And you would be omitting steps then, of course. You would probably not do steam, massage, or extractions. And cleansing and masking are going to be the most important elements because those are going to provide the most visible results. Typically, the focus is going to be on one area of the face, and you would be providing a quick exfoliation and hydration. And with the express facial, these can be performed with other services, so it will be something that we will do during body wraps. We will offer a little express facial if a client comes in for a body treatment, and we would try to be upselling that service. And sometimes starting out with an express facial can lead a client to booking another treatment. So it's a good way to introduce the client into a service, and it might lead them into booking a full basic facial to more address any skin concerns and conditions that they have. And performing a mini procedure, so the express facial is on page 322 in the book if you want to look at that. And question number 3 is, how does an express facial differ from a basic facial? So for instance, what steps are typically included in an express facial compared to the basic facial? So moving on for treatment goals for each skin type. For dry skin, the cause is usually the result of underactive sebaceous glands, and it also could be caused by an overexposure to the sun and wind, harsh soaps, or poor diet. Also, lack of fluid intake, certain medications can cause dry skin, environmental factors, aging, and its position. For treatment goals for dry skin, we want to hydrate the skin with rich mask and creamy cleansers, as well as use a gentle form of exfoliation to help remove the dead skin cells and prevent them from accumulating on the surface. Also, massage can be very effective. For treatments specific to dry skin, we want to use serums and creams that help balance and protect the skin. You can use gentle enzyme peels or a gentle AHA peel or a light microdermabrasion to exfoliate. For masks, you want to use things like peptides, hyaluronic acid, or emollients, and natural ingredients, or a thermal mask can be used. Using massage and a galvanic machine to assist in application of a hydrating serum is helpful. You can use LED treatments, and you want to pick out oil-based moisturizing creams, antioxidants, and full spectrum sunscreens for finishing steps of the facial. For a client with dehydrated skin, they are lacking water. So some clients might have enough oil, but they still feel dry and flaky, and that would be a more dehydrated skin. So the major cause of dehydrated skin is evaporation or transepidermal water loss and loss of sebum from the surface of the skin, which can be from harsh soaps or alkalis, and as well as like just in the drier months, and heat or overexposure to heat and different changes in the climate can affect the skin and for people to become more dehydrated. So the treatment goal of someone with dehydrated skin would be to restore the internal skin hydration and retain inner moisture by preventing transepidermal water loss and concentrating on hydrating and nourishing treatments and massaging with the use of serums. So transepidermal water loss, or TEWL, is the natural tendency of moisture and cells to move from the lower layers to the upper layers of the skin via osmosis. So when the natural moisturizing factor, or the NMF, is washed off, the cells begin to dry and crack, and the moisture can then evaporate out of the skin. So when treating dehydrated skin, we want to maintain the natural moisturizing factor and the natural acid mantle. And if the client's skin seems to be dehydrated from factors that require medical attention like their diet, lack of fluids, or medication, we want to recommend that the client seek the advice from their physician or a dermatologist. And facial treatments can help improve the general health of the skin and help it retain its moisture. And the use of anti-aging skincare can be beneficial for dehydrated skin. So superficial dehydration will overall lead to superficial fine lines, biological change. So there's moisture loss that create the fine lines and wrinkles. There could be a reduction of estrogen, collagen, and elastin for women that go through menopause. There's an epidermal thinning that happens as we age, and the derma papilla is going to flatten, which results in a loose tissue-like texture. Overall, cell renewal is going to slow down, which is why babies are super soft, because they have a very high cell renewal rate, while as we age it slows down, which makes our skin not as soft and supple. And the slowing down is going to also slow healing happening. Impaired circulation is also going to result in uneven desquamation, which is the skin's natural shedding process, which would also affect the skin tone. And the stratum corneum, which is the outermost layer of the epidermis, becomes more opaque, which can result in a yellow grayish skin tone. And repeated movements result in the expression lines around the eyes and mouth or on the forehead. Pollution can also be a cause of mature and aging skin. So there is matter that activates multiple pathways of inflammation in the skin, which would then ignite melanocytes. So it makes them make more melanin, which would result in hyperpigmentation. It can also excite enzymes, which would reabsorb damaged collagen and can cause chronic inflammation, which would cause enzymes that aren't good to remove more collagen that can be created, which would result in the skin laxicity, which would also then make more fine lines and wrinkles. Other causes of mature or aging skin can be from poor diet. So some dairy products can contain a hormone that causes inflammation, and this can increase the amount of oil that the sebaceous glands secrete, and that can result in acne and clogged pores. Then it also makes it harder for dead skin cells to clear out and allows oils to collect and become inflamed. Sugar also increases blood sugar levels, which spurs insulin and an IGF-1 production, which causes inflammation. And high amounts of sugar can also react with skin cells and cause dryness, decreased colors, and wrinkles. And also caffeine causes dehydration. So although these dietary changes, we can't technically recommend our client to encourage clients to remove foods from their diet because we're not nutritionists, and the client should just consult their physician or a nutritionist if it might be a concern from them that their diet is affecting skin concerns. Hormones are also a really big cause of changes in the skin. So as we age, the body's going to produce lower levels of hormones, and the ability of the hormones to communicate messages are going to decrease. So some effects of the imbalanced hormones in the skin aging is going to include excessive blood glucose, which can damage and destroy collagen, and excessive free radicals, which can cause damage to the cells and hyperpigmentation, resulting in changes in estrogen and progesterone. And in men, testosterone will eventually decrease too, which would result in hyperpigmentation, thinning skin, uneven skin texture, and reduced skin firmness. So even more causes of mature or aging skin include stress. So the secretion of stress hormones like adrenaline, cortisol, or norepinephrine into the bloodstream can bring out some specific physiological changes, and that's going to be some hyperstimulus effect that can impair normal cellular renewal cycles in the skin, and effects would include inflammation and redness of the skin. So one of the biggest, if not the biggest, cause of mature and aging skin is going to be from UV exposure. So repeated exposure to ultraviolet sun can cause premature aging in the skin, and artificial UV sources like tanning beds can affect the client's end stages throughout their life. Some other external factors would be improper or insufficient skincare, medications or physiological diseases, poor health, and psychological problems. Also, extreme weight loss and other lifestyle choices can affect the client's skin. Some beneficial ingredients that we can use for aging or mature skin would be antioxidants, because they're going to help protect the body from free radicals, both topically and orally. Wearing sunscreen is going to be the best preventative measure that we can take, because it's going to help protect the barrier function of the skin. Alpha hydroxy acids can help combat signs of aging and sun damage. And hydrating ingredients are going to bind water to the skin and help retain the moisture. Peptides, lipids, polyglucans, coenzyme Q10, and other liposomes are also beneficial for performance ingredients to help keep the skin nice and plump. For different treatments that we would do on mature or aging skin, they may be similar for the treatments for dry skin, and adapting the ingredients to include the ones that help reduce the appearance of fine lines and wrinkles is going to be what you mostly do for someone that's a little older. You can extend the massage with a moisturizing serum and cream, employ peptides, collagen, and hydrating masks. Use a thermal mask, which will help force feed nutrients in the skin and help soften the appearance of the skin, which would help diminish the appearance of fine lines and wrinkles. Firming products can be effective in visibly tightening the appearance of the skin. HA treatments and products can help exfoliate the skin and create a more luminescent complexion. And advanced treatments like light therapy, ionotophoresis, and galvanic and microcurrent are also effective tools. So moving on to sensitive skin. Sensitive skin can be a biological condition that reacts to factors resulting in skin that appears blotchy, broken out, or excessively dry. Skin can also become more red and warm to the touch. Sensitized skin can result from over-aggressive exfoliation or from exposure to aggressive environmental factors, and it can become highly sensitive and must be treated as sensitive skin until it returns to a normal state. So my skin is sensitized skin if I do a little bit too much of exfoliation or just trying out too many products at once, compared to a true sensitive skin is kind of like that all of the time. Rosacea is a medical condition that estheticians cannot treat or diagnose, but typically it manifests as redness in the central area of the face, including on the cheeks and the nose, and it can be characterized by flare-ups and remissions. So there are certain things that flare up or exacerbate the rosacea, so like alcohol and spicy foods or heat can be a little bit more exacerbating of rosacea. If rosacea is left untreated, pustules and large inflamed nodules can also result that are often misdiagnosed as acne, and after a prolonged period, it can result in permanent enlargement of the nasal tissue. So it's good to get it treated if you think you might have rosacea. Individuals who are sensitive or sensitized or have rosacea should avoid strong exfoliants. Exfoliants such as coarse manual materials, microdermabrasion, aggressive AHAs or BHA peels, vacuum suction, the brush machine, or any ingredients of a pH of 3.5 or lower. They should also avoid using steam during a treatment, stimulating machines, or manual massagers. So using a cooling massage device can be used instead, and it can be more manipulated to be gentler on the skin. You should also avoid drying products with a pH of 8 or higher, and excessive heat like hot water, steam, or towels. So lukewarm water should be used instead during facials. The treatment goal for rosacea skin or sensitized skin or sensitive skin is going to be to identify and avoid stimulus that provoke a response, provide the skin with topical application of ingredients that help calm and soothe the skin, help maintain the skin's protective moisture barrier, encourage the client to consult a dermatologist if you think that's necessary. And for home care, you want to advise the clients to avoid heat, the sun, spicy food, and stimulating products. Some things that you can incorporate into facials would be to use a gentle cleanser that doesn't strip the skin's lipids and barrier protection. Use cold towels because those are going to be more vasoconstricting, which is just constricting the capillaries and the blood flow. And using an enzyme peel specifically formulated for sensitive skin to gently exfoliate the skin. You can also use a soothing cream or gel mask to help calm and tone down the appearance of redness. Lipids can also be used to create a moisture barrier. Using a serum or moisturizer that has hyaluronic acid or squalene can help soothe the symptoms of sensitive skin. And using a silver ball or cold globes can also be used to calm blood flow and reduce redness. So for our treatment goal for hyperpigmentation, it's going to be overall to reduce the hyperpigmented areas, and chemical exfoliation and brightening agents can be effective in reducing some of those hyperpigmented areas. Things that we can incorporate into our facials would be the ingredients that can help brighten the appearance of the skin and work to help reduce the appearance of dark spots. And those ingredients can also be used in conjunction with exfoliating treatments. The use of harsh skin bleaching agents can actually cause damage to the skin and are quite controversial. And overexfoliation can also cause damage and make hyperpigmentation worse, or also cause hypopigmentation. So for oily skin, the cause is from overactive sebaceous glands. So our treatment goals are going to be to deep cleanse and purify the skin and keeping pores free of comedones. So because the skin can break out a little bit more easily, it is important to treat the skin with an effective deep cleanse and using products that will help purify, like clay mask, for example. Using galvanic current, steam, and extractions can also benefit oily skin, which would help keep their pores free of comedones. And exfoliating with oil controlling ingredients and beta hydroxy acids can also give better results for an oily skin type. So for question number 4, I want you to list a treatment goal that is beneficial for each of the skin types. So for dry skin, dehydrated skin, mature skin, sensitive skin, hyperpigmentation, and oily skin. So moving on to acne-prone skin. Skin with acne has many of the same characteristics as oily skin, but also hormones, stress, and other biological factors have caused the formation of acne pustules. And blackheads, whiteheads, pimples, and pustules are going to be present and are easily infected with bacteria. Our treatment goals are going to be to eliminate blackheads from the skin that lead to more breakouts. Having a thorough cleanser and deep cleansing mask that include alpha hydroxy acids and beta hydroxy acids are going to be recommended, and the facial treatment should include extractions typically. Extractions should be done gently without pain to the client, and treatment care and the client education regarding acne should be ongoing with results rewarding for both clients and estheticians. For the acne treatment, we want to outline a treatment plan to help balance the skin. So treatments should focus on deep cleansing and extractions. You should look for indication of acne exorce, which is clients that pick at their acne and cause bleeding. And you should partner with the client on proper home care and educate them on histology of acne within the skin. So products and equipments for acne care that we would use. We want to use a disincrustation solution, so like our softening gel, Steam and extractions are typically all part of an oily skin problem facial. Using beta hydroxy acids, so a salicylic acid, will help dissolve the keratin. Using sulfur mask can help exfoliate the skin and dry blemishes. Using alpha hydroxy acids like glycolic acid, lactic acid, malic acid, and citric acid are going to help dissolve dead skin cells. Using a vitamin A based product or like a retinol or retinoid will help reduce flaking and restore the appearance of the skin. And using a benzoyl peroxide is going to help release oxygen to kill bacteria, and it also exfoliates the skin. Kojic acid helps brighten the appearance of the skin, so that would be beneficial for people that are prone to post-inflammatory hyperpigmentation after they've had acne. Using spot blemish treatments would be something that you might want to recommend a client to use at home to help keep new acne in control. And increased vitamin C, because vitamin C is an antioxidant and has healing effects on the skin. Some acne care tips would be to eliminate comedogenic products. So oil-free doesn't necessarily mean non-comedogenic, so oil typically isn't like a whole no-go for people that have acne, but we can also help control oil through proper product usage and exfoliating the skin using beta hydroxy acids or alpha hydroxy acids are going to be the best bet, because we don't want to irritate the skin with manual agents, but we also don't want to overuse them because that can cause more irritation and more harm to the skin, which can then cause more breakouts. We want to protect against environmental aggressors and dirt and grease, UV light, humidity, and pollution. Practice stress reduction and good nutrition, and have regular facials like once a month or as needed. So home care for acne. Picking at blemishes or performing self-extractions can cause infection, which would then require a client to see a dermatologist for treatment. And all home care should include an analysis of the lifestyle to help the client understand acne triggers. Some products that you can have a client with acne use would be a cleanser, an exfoliant, a mask, a toner, a lightweight hydrator, and then a full spectrum SPF. And some other tips would be to recommend ingredients that aren't irritated or contraindicated. Using a foaming gel cleanser with an exfoliant is a good choice. My preferential is a gel cleanser with salicylic acid. You can maybe recommend the use of an astringent with alcohol, which would help prevent infection, but that would not be something I would recommend a lot of people with very inflamed acne, or something that I would have a client use every day. You can have your client use a light hydrating oil-free moisturizer and then an SPF over top. You can have them use a clay mask twice a week, or one that has camphor and sulfur in it, and a hydrating soothing mask then also to balance any of the drying products that are used to treat the acne. For extractions, it is one of the more important skills an esthetician will learn if they're going to be doing extractions. And the importance of infection control is essential, especially when performing extractions, and the process of infection control has to be done correctly, and it has to be executed before, during, and after of each treatment that you're doing. If you're using any reusable instruments, they have to be placed in a sterilizer or an autoclave, which completely destroys all microorganisms, including bacteria, viruses, fungi, and bacterial spores, with highly pressurized steam. And we have to do this because with extractions, there may be blood that comes onto the tools that we use. If you don't have a sterilizer or an autoclave, you would need to use disposable instruments, because those would be disposed after every use to avoid cross-contamination. So with extractions, the skin has to be exfoliated and warmed before the extractions are performed, and it's imperative that the esthetician wears gloves during the extractions and then changes the gloves before performing the rest of the facial to prevent the spread of the infection. And you should also wear protective eyewear because sometimes when you go to do an extraction, it can pop out and fly out, and you don't want that in your eye. And you should not practice extractions without proper instruction or training. So the different extraction methods, there is manual comedone removal, which uses gauze wrapped around the gloved fingers, dampened with astringent, and it's useful for the majority of the extractions that you would be doing. Comedone extractors are metal tools that are used for open comedones and sebaceous filaments. And again, if you're using anything that is metal, those would technically have to be sterilized in an autoclave. So we wouldn't technically be able to do them since we don't have one. Comedone swabs, which you can use cotton swabs, and those are helpful around the nose area since they are smaller than the fingertips. And lancets are small, sharp pointed needles that are used to make a tiny opening in the epidermis, and they're used to remove milia or pustules, and we cannot use them in Illinois, unfortunately. But there is a picture of someone using a lancet on the screen right now. So with extractions, you have to be extremely careful because if you perform them incorrectly, extractions can cause skin damage, infection, or scarring. So for the treatment of milia, which are closed comedones, they are small epidermal cysts, which are also referred to tiny whiteheads, and they usually occur around the eyes, the upper surface of the cheeks, and the forehead. And milia are keratinized sebum trapped under the skin surface, and you a lot of the times would need help with a lancet to expose them, and you would always need a new sterile sealed lancet if you were able to use them in Illinois, or if you move to a different state and you're able to use them, you need a new sterile lancet every time. And in your book, the procedures 8-7, which is performing extractions, is on page 375 to 378. So question number 5 is to list 4 acne care tips that you can suggest for clients with acne. So for an acne treatment procedure, you would, of course, step 1, wash your hands and put on gloves. Step 2, perform deep cleansing. Step 3, analyze the skin. Step 4, steam and apply serum. Step 5 would be to proceed with desincrustation. Step 6 is to perform extractions. Step 7, apply an astringent or a toner. Step 8 is to apply a clay-based mask for deep cleansing and remove with a towel. Step 9 is to apply a soothing mask and remove with wet cotton. Step 10 is to apply moisturizer. Step 11 is to perform galvanic or high frequency. And step 12 is to finish with the post-treatment consultation. So I realized that I put an extra question 5 in here. So if you answer this one, I'll give you some extra credit. So number 2, question 5 is, what are the 4 important points to cover in the post-treatment consultation with a client who has acne? Moving on to men. For men's skin, typically it's more excessively oily and can have some surface dryness. So men typically have larger pores and more active sebaceous glands. Their skin tends to be more characterized by excess oil, and they may have more blackheads. It's often dehydrated from using harsh soaps and shampoos and frequent hot showers. And products and treatments are going to involve more hydrating, but offering a deeper pore cleanse and pore refining. Men are starting to care a little bit more about their aging, so a lot of them may have more hyperpigmentation from outdoor activities and not applying SPF. Some may have more crow's feet and dark under eye circles. And since the baby boomers are confronting their middle age, some of them that might be more concerned with aging, and millennials generally are caring a little bit more about their grooming. Some tips for doing facial treatments on men would be to avoid using perfumed or fragrant products in the facial room, because men typically have a little bit of a weird and apprehensive feeling about having a facial, so keeping the service as clean and simple as possible will be the best. Also, you can cater to specific needs by incorporating more grooming services like trimming or waxing their eyebrows, their nostril hair, or their ear hair. And most men don't want to walk out of the spa with red, blotchy skin caused by aggressive extractions, so using additional services to help calm the skin and apply products and even concealing makeup can be considered. When you decide on a retail line for males, you should keep in mind that the kinds of packaging that many men prefer, so it shouldn't be pink or red, but more sleek and simple looking. So you should use products that can be sprayed on quickly and swipe jars for bottles with pumps so they can easily pack them in gym bags for trips. Retail products should also emphasize qualities like non-greasy, rinses off easily, and protects the skin. Or even also like perfume-free, color-free, calming, and stress-reducing. When you market to men, you should be simple and direct. So men in general want only to use a few products on a daily basis, and male clients are willing to follow suggestions and want a basic and consistent routine. Men tend to be more loyal customers, and they also represent a growing percentage of the spa's business. And although it's a challenge to attract them to the first visit, it's a good idea to offer special services designed for males. So instead of having like them pick a basic facial, have a designated men's facial for them, so then that way they don't feel weird about booking it. Also, you want to make them feel comfortable, so assure them that it's normal for men to have spa services and to practice good skincare habits, and conduct consultations privately instead of in front of other clients. And some spas even just cater to men only. So for skincare products for men, you should try to find more unisex product lines, so having the packaging and fragrance should not be overly feminine. And you should address men's skincare traits, so you should address their oily skin, more dehydrated skin, and their need for sun protection. Having more basic products and having a more simple routine for them will help them stay consistent. So not having anything that's highly fragranced or feminine, having a lightweight and highly absorbent product, so more of a matte finish and nothing too oily or greasy, and having multi-purpose products is good, and then also having more specific instructions for them of how to use and when to use the certain products. Some tips are to have tubes and pumps because those are a little bit more easy to open and are more travel friendly. And having a home care regimen should only begin with a couple products. So I would recommend someone to use a cleanser and a hydrating lotion at night, and then in the morning a cleanser and then an SPF. And then as they grow more accustomed to the regimen and they see results, they're more likely to add a little bit more to the regimen. You should educate your client on sun protection and skin cancer facts, and the esthetician can also suggest that male clients shave downward so it's less irritating. And then once your client is more accustomed to receiving treatments and using products, they will be more likely to use like an eye cream if they're taught how. So in professional treatments for men, using steam in a brush machine is very popular. Also having a firmer touch or a deeper massage. Using sponges and towels during facials instead of gauze, if you were to use gauze, will help prevent leaving particles in the beard. And using exfoliation on shaven skin. So because shaving makes the skin a little bit more sensitive, it could be a contraindication. So typically if someone's going to shave, I would recommend them shaving like 2 days in advance before the facial, so you can still do more of the exfoliating on that beard area. When you're doing massage movements with beards, they should flow a little bit more down the hair growth, so more downward instead of upward. And the beard area can be a little bit more sensitive, so you should use more calming and healing products. So a few terms that you guys should know would be folliculitis, which is inflammation of the hair follicles. And this can be more of a problem for men, especially if they have a very coarse and curly beard. and it's basically an infection characterized by inflammation and pus. Folliculitis barbae is when hair grows slightly under the skin and is trapped, so it's basically an ingrown hair, and it's causing a bacterial infection. So the treatment goal is to alleviate the irritation, dry up and disinfect the pustules, and then desensitize that area. Pseudofolliculitis is also known as razor bumps, and it resembles folliculitis without the infection. So this is a condition that results in improper shaving techniques. And when you're recommending products for ingrown hairs, you want to recommend them exfoliate to help keep the follicles open and use a foaming cleanser. And then I would also suggest moisturizing with a fragrance-free moisturizer. And that's like for anyone with any ingrown hairs anywhere. You want to exfoliate and hydrate the skin. So for conclusion, our learning objectives were to explain the importance of facial treatments as the foundation for all skincare services, describe the benefits of a facial treatment, list the essential skills needed to successfully perform facials, perform the facial setup procedures, explain the key steps of the basic facial treatment, describe how to consult clients on home care, discuss the variations of a basic facial, outline the treatment goals for 6 skin types and conditions, describe acne facials, perform an acne treatment procedure, discuss men's skincare treatment options, and perform the facial treatment procedures. And that will officially conclude our Chapter 8, Facial Treatments, in the Standard Aesthetics book.